Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
This is something that my daughter and I put together. It has to do with the fact that what you do with your genes is as important as what your genes do with you. And uh, we talk a lot about genes sometimes and forget that actually what we do with our bodies in terms of our diet, exercise, other things is just as important, maybe more so than the genes that we receive from our mothers and fathers. And this is just to emphasize that what we have is from mom and dad in terms of the DNAs and RNAs modified by outside and inside and the things that we do. And so that becomes very important so that we don't blame everything on mom and dad when in point of fact, much of it is related to us, what we do after we're born. And so I think that is one of the things, as many people are concerned that who their forefathers and foremothers were and what continent they come from. And that's important as well. But perhaps equally important is how we treat our bodies after we're born, after the genes that we're given are not something that defines us, but our lifestyle is what really defines us. And though we may be predisposed to some diseases, whether or not we get those diseases depends upon many other things. Though you may have a strong family history of diseases, as you see here, uh, sometimes eating the right foods and exercising and meditating, etc., can be an important way to overcome some of the genetic factors that we have. For example, uh, stress, as we talk about, is a very important factor. Being Black, of course, is an important stress factor as well. In the United States, not sure how much that is operative if you're in Africa, but certainly if you're outside of Africa, it is clear that that is an important factor. Poor sleep patterns is also not good because all of that influences your genes negatively. And this is what is more and more studies are identifying how important sleep is. Clean water consumption is essential. And of course, yoga and the uh, other exercises point out how important the way you breathe and how much oxygen you take in affects all of your tissues. And then some of the medications we take may also damage us to some extent. So we have to, if we have to take medication have side effects, we need to let the doctor know so that they can change medications for us. And then, of course, there's little question that ultra processed food and food additives uh, negatively impact all aspects of us, from the top of our brain to the bottom of our feet. And then, of course, one of the things we talk about every time we meet is the importance of exercise, physical exercising as well as mental exercising. Yeah. So the bottom line is that the genes you inherit play a vital role in your health, but there are other factors, and we call them epigenetic factors that determine how genes are expressed. And paying attention to these factors may result in having a longer life than you would have otherwise. So I'd open the floor for any discussion. It's an area that I think we need to emphasize as much as possible because that's how people live long lives, even though their forefathers and foremothers may not have lived as long. Any comments or questions on additives?
My question, Dr. Callender, is how are the time elements related to genetics and epigenetics as far as generations are concerned? Is it like 20 years, 30 years is like one generation that you know that it was definitely heredity and not environmental?
So I'm not understanding your question. Could you repeat it again?
Okay, I'll put it another way. I know a doctor that was doing a study to find out how, the foods that we ate as slaves affected our genes, how many years later? 10, 20, 30 years later. That was the question, it's a time element.
Oh, I see. Okay. Yeah. Well, I don't know that we know. I know we know that you within 5 years, the impact of what you eat can affect you in a good or a bad way. So in other words, if your nutrition and exercise lack exercise and don't sleep well, that the impact upon your health would be manifested anywhere from 5 to 10 years. But I haven't seen any studies that have actually quantified that in the detail to which you're asking that. Uh, so I'm just giving you my opinion about it, but I haven't seen any data that times it, because you're trying to find out what if you change your health habits, how long will it take for it to manifest? I think it probably takes maybe 6 months to a year to manifest itself, but the long term benefit is there for perhaps decades.
Thank you. That does answer my question.
Any other comments?
Yeah, in the short term, Dr. David Bowman a couple of weeks ago was saying that the Daniel fast, he recommended that for 3 weeks, and he said that people started feeling better right away during the Daniel fast.
Right, right. Mm-hmm. Any other comments or suggestions? Okay, well, let's go to
What
the
about
next.
Dr. Dunstan? Is she still studying this issue? And when will she be back to see us?
What was your question?
Uh, Dr. Dunstan, is she still working on the study?
Well, Dr. Dunson has been sick recently and haven't been able to get in touch with her. So she had some health issues, and I don't know what her status is. I've been trying to reach her for the last maybe 10 months, but unsuccessfully. So I can't give you an answer to your question. I was hoping that her book would be out by now, but I haven't seen or heard from her in the last 10 months. This next article, it talks about National Minority Donor Awareness Month that is with us this month, is dedicated to getting the message out about the need of all people to become part of the donor population. An ounce of prevention is worth a pound of cure. And so one of the first things we can do is to try to live healthy and prevent getting kidney failure. Now, of course, hypertension and diabetes are the number one cause, but obesity and many other diseases related to it. And so I think having a healthy lifestyle is an important part of it to prevent the need, getting kidney screens and finding out if you have protein in your urine, which is the earliest manifestation of it. And then, of course, preventing the need is, of course, important. And then if you do have kidney disease, then one of the things is to get it treated early and reverse the damaging effects of kidney disease. And then, of course, the opportunity to be a donor in life and after death. Of course, John Buchanan has led the way with his more than 100 blood donor transfusions, but giving, as uh, Christ has taught us, it isn't giving that you receive; it's in pardoning that you pardoned. It's dying you're born to eternal life. So it is an opportunity for all communities of color and communities that are not of color, to recognize the opportunity that you can give organs in life and after death, and tissues in life and after death. Because of the shortage of donors, um, anywhere from 12 to 15 people die every single day. And so one donor can save 8 lives, and the tissues can enhance the lives of some 80 people. So this is a time for communities to be educated and empowered so they can become part of the solution. And they are having a special webinar, as you can see here, Tuesday, August the 20th. And actually, the entire month is donated to doing things to heighten the awareness of the need for people of color to become part of the solution to the problem.
I wanted
Any
to, yeah, I wanted to inform everybody that you can actually click on that where it says register now, and it'll send you right to the web page where you can register for the webinar, and it's free, of course.
This is Hearst's contribution. It's nice for them to really sponsor it in this fashion. Okay, go to the next one. This is an interesting article about how to discard your old pill bottles. They talk about the fact that there are a lot of different ways to do it, yeah, but they're not so happy about us just putting it in the trash. They talk about recycling. Some of them can be recycled, but as we know, the plastics are contaminating the earth. And so trying to avoid having all this plastic in landfills and in the oceans, because they are actually consuming us. But they identify 3 or 4 different ways that you can, in this article, 3 or 4 different ways you can recycle your pill bottles, or give them to places after you take off the labels, and give your pill bottles to places. As you scroll down, you'll find where you can donate them. Just scroll down some more, and it talks about organizations that will take pill bottles, since they may be a hazard when you just put them in the trash. Animal shelters, humanitarian aid organizations, homeless shelters, many of them, although they want you to take off the labels before you donate them. Any comments about that? Any of you have had other novel ways of getting rid of your old pill bottles?
Dr. Callender, I know at CVS they have a bin for prescription bottles. You know, when you actually finish using or you have leftover prescriptions. That's where I normally take mine. I just drop it
Yeah,
in
that's
the bin
good.
at CVS.
Yeah, that's good. Good.
I was wondering, I think it takes some work to get those labels off. They don't
Yeah, yeah, it does.
might have
Some
to soak them overnight or something, try
Yeah.
some different methods. I actually tried taking a Sharpie and just, going over it, but that probably adds to the pollution. But yeah, getting rid of that paper is more than a notion.
Any other comments? If not, let's go to the next one. This is an interesting article that talks about the 14 modifiable risk factors that may make dementia preventable. And I think this is something that is important to be aware of. And they itemize hearing loss, hypertension, smoking, obesity, depression, physical inactivity, and diabetes, excessive alcohol consumption, and air pollution, and social isolation. So that something we can do about many of these things to prevent delirium, dementia. And then, of course, more recently, the high cholesterol is added to them. So you've got 14. Of course, one of the newest uh, entrants is the high cholesterol level, which is also a cause of dementia. They say all this to say that it's not inevitable. It's it's interesting to see some very old people who are very mentally alert, and yet we have so many older people who aren't. So, so this kind of offers some hope in terms of how modifying those things that you can and treating problems like hypertension, diabetes, etc., can decrease the likelihood of developing dementia. You have exceptions to every rule, though. You have some people over 50 who develop dementia, and variations on the theme. But I think this is looking at the positive side of it, ways of preventing dementia. Any other comments or
Yeah,
thoughts
I'd
about
make
it?
a comment. Something we've talked about before is that there's a link between ultra processed foods and dementia.
Right, and there's another article that talks specifically about
There's going to be a theme coming up starting right now.
it. Yeah. Now, this is the glucagon receptor agonist, which very common now for treatment of diabetes and obesity, is now also thought to be good for dementia prevention. So this GLP, although it's hard to get because so many people are using it for obesity and for diabetes, but it's turning out to be one of the great finds of this decade. First used for diabetes and then obesity, and was startling results, and now it's seen to be neuroprotective. So trials are still going on, but the early evidence suggests that these GLP agonists can also prevent dementia. So this is a more recent finding. It's interesting that this therapy can be given by injection or by pill. But injection is a common way of administration. The only problem recently is that so many people are using medication that it's sometimes difficult for patients to find it, and it's important to take it as directed, which means at least once or twice a week. And can't get the drug, then you can't take it. And so this has been a great concern for many who try to get GLP products, and they're sold out.
Dr. Callender, so I'm thinking that it's really going to be difficult to determine whether a drug is going to prevent Alzheimer's. You know, how how is that possible? I mean, you have it, and then you have it. You can measure.
Well, you do the same studies you do for vaccines. You get groups of people and you study them. You give them. You have groups that have the medication, groups that don't have the medication, and see what happens. It takes time, but it can be studied. It's just that they don't have the kind of study. So far, we haven't had any studies that demonstrated without question that they can treat Alzheimer's once it's developed. So our efforts at prevention are so far remain to have the long-term double-blind studies that we do with the vaccines, but that's the kind of studies that we need to have to demonstrate whether or not medication can actually prevent. So early on, they're making these statements based upon limited studies, but there are ways of confirming that they haven't been done yet. But those are the kind of studies that will need to be done to convince you and me and everybody else that the therapy is actually effective.
It seems like it would take a long time, though. Like
Yes, absolutely.
10 years or something like that, to
Probably.
really determine whether it's good or
Unless you get a medication that actually treats the disease and knocks it out. But in terms of preventing, you're right, it would take probably 10 years. But if they found a medication that actually reversed it, that could be demonstrated within 5 years.
Got it.
But they have, to my knowledge, they haven't found that drug yet. So, but so the early studies are suggestive, and that's what they're sharing now. And it's just more and more evidence it's linking ultra-processed foods to dementia. And so the call to do away with hot dogs, bacon, sausage, salami, bologna. It's interesting, you hear all that, and then you see all of these hot dogs still being sold and everything else. So it's freedom of choice. So people are free to eat these ultra-processed red meat.
Dr. Callender, they don't have spam on that list.
No, they don't.
And Dr. Callender, when you say freedom of choice or informed consent, it's critical that people are informed. And though this group are subject matter experts on that topic, it's not true for most of our community. So that's why we must disseminate this information, because there are many in our community that may consume without really knowing the benefits of not consuming.
Very true. Very true. Question is, how do you get this message out? Because it's not that that people are hiding it, but because the information is out there. Question is, how do you put it in a form that is the community is able to digest, and then get that information disseminated throughout the community so that the community can do better. Some would argue that as long as you have these food deserts, that people will take the easiest way out, which is in spite of information to the contrary. But that needs to be proven by long-term efforts that you're talking about, that actually go into the community and actually educate and empower them to really change their lifestyle.
In retrospect, I think the Black Panther Party did that with the breakfast program and took it to a totally different level. And I, just as an example of how important it is, if you're hearing it from the pulpit, you're hearing it on your kitchen table, you're hearing it waiting for the bus online, whatever. Just like we have to get the word out that there's no options other than Vice President Kamala Harris for the office of president. We have to roll up our sleeves and get back to what we did before the drum.
Well, I think that it's very important that all people get that information that we may take for granted, and finding ways to demonstrate it is the issue. How do we get it out? I think the proof of the pudding is when you look at all of the commercials, none of them have any nutritive values. All of them are ultra processed, and so therefore you brainwash most of the people with these poor nutritional foods, and they think that is what is okay, and it's not. And so, how do you combat that? It's as you said, it's more than a notion. And of course, one could argue that this little small group is the kind of group that you need in all communities, so that they can be educated. And then after educated, being educated is the first step. The second step is to put what you've been taught into practice. And that's the issue that we're having trouble with. But I think there's no scarcity of information. Scarcity is getting the community to overcome the brainwashing process that people who watch television or listen to the radio have to deal with. Any other comments? Ideas?
Yes, good morning, everyone. One thought that I had is eating right, I guess is a good word to use, is usually more expensive than just eating the things that are advertised. And
Right.
so lots of times people may want to do something, but they don't have the means to eat the things that they should be eating.
I have a comment to that. Just using those interesting choices of words. Eating right is expensive, but eating poorly also in the long run is going to be expensive.
Yeah. And double whammy. Yep.
People don't usually look further down the road.
Yeah.
I have my hand up
Go ahead.
because I had to. Yeah. Okay. Well, it's apples to apples. An organic apple is more expensive than a conventional apple. We know that there's a premium for you go to the produce section, and organic is more expensive than conventional. But the most expensive item on your food budget is meat. So you eliminate meat from your food budget, your grocery budget overall is down 33%. You save money by being a vegan. When you talk about eating right, this article says red meat. You could have another article that talks about chicken, pork. It's not just red meat, it's all meat. You eliminate meat and fish from your diet, you save 33%.
Any other comments?
I think, and I agree with that, it's important for us to connect the dots for our community. Just like the dots were connected in the bus boycott, we have to connect the dots for our community so that they see that, yeah, it might be cheaper today, but it's going to be more expensive later on. And so I think that's very important.
We got this wrong association with history. We talk about soul food diet, part of history. That's not our diet. That's not historically our diet. That's Paula Dean's diet. In slavery, they gave us the menus, put us in the kitchen. We're cooking white folks' food. We're not cooking our food. You go back to African food, it's not saying that West Africans, and that's our roots, West Africans, it's not saying that they're 100% vegan, but they were not an entree, meat-driven diet. Had little meat, not a lot of meat. We go a lot of meat. This soul food diet that's killing us, like Dr. David Bowman, he said, got this book, they're trying to kill us, and they are. This is not our diet. This is not our history. We got the wrong associations. We're in love with stuff that's Paula Deen. It's not us.
Well, it's interesting because in many ways, one of the things that is true is that it's not just directed toward us. It's directed toward everyone. It's not just, they're not just trying to kill Black people. They're trying to kill everyone. I mean, when you look at the commercials, you realize they're not just for Black people. They're for white people, Black people, green people, anybody who will spend money. And so you have to keep that in mind as well. John Tatum.
Yeah, I think we discussed this before in another article where we talked about how we related the bad food diet with the cost of healthcare. You remember that article?
Many. Yeah, many articles like that. Yeah, right. So it's interesting that we say that they're trying to kill us. Actually, uh, commercials are directed at anybody who wants to spend money, and if you want to spend money and you're green, white, purple, they don't care. They just want you to spend dollars on their products. That's all. And those products are killing us, no question about that. But it's not that it's solely directed toward the minority communities, directed toward communities, all communities. And we, of course, who don't have much of the many resources, will find that it's cheaper to eat the non-nutritive foods. And they've been doing it for so long that they think it's okay. They think that hot dogs, bacon, and all that stuff. You go to those who go to the movies, you see that you look at the people and see how they eat, and it's interesting. None of them are eating in a nutritive fashion. Any other comments about these topics that are so important to our community? Yes, Betty.
Yes. What Daryl said about all meat, but I see in most of the articles they cue in on red meat. So is red meat worse for you than say chicken or
Turkey? Yeah, most of the data would say that, but Darrell doesn't agree. But most of the data does identify and quantify red meat as the biggest victim of it. The other meats are not ideal, but it's just that red meat is the one that they single out. Uh, Fish, as well as other different poultries, are not thought to be as dangerous as the red meat. And that's what we're talking about, the degree, the quantity and the qualitative difference, as contrasted with the veterinarians, vegetarians, and the vegans. The vegans, of course, eat no meat at all, no fish, no poultry, no milk, and all that animal products. Whereas the vegetarians don't eat any meat, but they eat all the other stuff. And then then there's other group who eat fish. So that and there's a variety. And on one extreme is the vegan, there's the vegetarian, and then there's the others.
Actually, I do agree with that red meat is the worst of the meats.
Now, from one extreme to another, too much coffee is linked to the accelerated cognitive decline. More than 3 cups of coffee a day is linked to more rapid cognitive decline over time. And of course, this is another substance that we taken from our European colleagues, caffeine. How many of you eat coffee, drink coffee? Not many of you, huh? Because it's almost un-American not to drink coffee.
I drink a lot of coffee, but this article is changing my behavior. So I want you all to keep me accountable. Okay, I need that. And support me as especially those times when I'm going through withdrawal.
Well, one of the interesting things about coffee is that you read articles that tell you how good coffee is for your health. And now you have another one that says it's causing dementia. Mark, go ahead.
Yeah, just based on the point you just made, so one of the top lines of this article, if I'm just giving a summary, all things in moderation, because it just said, 3 cups or more can prevent, I mean, are linked to, there it is, more rapid cognitive decline over time. So, but back to what you said, 1 cup seems to be fine. 1 cup of coffee, as we see later in the paragraphs, can reduce the risk for Alzheimer's. You know what I mean? So basically all things in moderation, just don't go overboard with drinking coffee and it seems like we'll be fine.
Thank you. Betty?
Yeah, also I see tea listed. And I'm a tea drinker, so is tea as bad as coffee or
Well, they highlighted coffee.
yeah.
Yeah, it's kind of
And
like red meat to all meats. Red meat is the worst meat.
okay,
Coffee has more caffeine than tea. I
okay,
forget the exact relationship, how many cups of coffee is equal. I mean, how many cups of tea is equal to a cup of coffee. But if you're a tea drinker, that's something to research.
okay.
Any other comments on this interesting article?
Another thing is the caffeine. They say caffeine in women promotes the hot sweats and all that, hot flashes and etc. And too much caffeine can kill you. Those energy drinks, not only, coffee, but energy drinks, chocolate, anything that has caffeine in it. So, but this is just spotlighting coffee.
Okay, let's go to the next article, please. This is kind of an interesting article, although it's to me it's much ado about nothing, because it says that if you take the newer shingles vaccine, you have 164 more days before you get the dementia. To me, that if 164 days later or not, it's still dementia. So I'm not so sure that they're really saying much with this article. Although I would agree that yes, 164 days, which is half a year, 6 months. It's okay, but I'm not convinced that this data is so remarkable. If you're talking to
I'm
me
not.
about uh, uh, years or something, but 164 days, please. That's what they're talking about. Difference in delay in dementia diagnosis of 164 days.
Yeah,
But at
I
least
had
one thing you
shingles.
can say, it is not causing dementia. So that's a positive aspect of it. It's not causing dementia. That's a
I had
positive.
shingles twice before I got the vaccines, and I'm not sure how that works between a relationship between shingles and dementia. But I can. My idea is that shingles just makes you lose your mind. Your mind says, "I'm out of here. Goodbye."
Yeah, well, those who've not gotten shingles are blessed. Once you get shingles, you have a new perspective on many things. What age did you get the shingles at?
Um, age. First time was about 2010. So 60 and 62.
Oh, okay. Yeah, that's around the right time. Yeah. Mm. How long did it last? Because you have some people who get that neuro neuralgia that goes with it, and it can be very debilitating for months.
So, Dr. Callender, I think they're saying that it's not the shingles that delays dementia, it's the vaccine.
That's what, yeah, that's correct. It's a vaccine, right? Yeah.
Could you repeat that? I missed that.
Missed the article?
I missed the point that it is that was just said.
It's the vaccine. The article is all about how the vaccine for shingles delays the onset of dementia. Not that shingles delays.
Oh, okay. Okay. Okay.
Now, this is an article that shows that if you're apathetic, that you have more amyloid deposition. So the question, which comes first, the chicken or the egg? The amyloid deposition or the apathy is the issue. And they're suggesting here that it's the apathy as a consequence of the amyloid deposition that is the issue. One of the complications of Alzheimer's disease is that we do not know really whether it's the amyloid that is causing the Alzheimer's. The presumption is that it may well be, but it ain't necessarily so. So that's why, because you have medications that knock out the amyloid, some of these medications knock out the amyloid, still don't knock out the dementia. That's why there's concern as to whether or not there's a cause and effect. And that's why the medications that knock out amyloid have not been demonstrated to stop the progression of Alzheimer's. But nonetheless, there is a link between the amyloid deposition and Alzheimer's disease. And when you have apathy, then that brings a question. Mark?
Could you break down amyloid? So I'm gonna try to give it my best guess, because it, pretty high level terms here. But so amyloid is a part of the brain, and deposition is like a lack thereof. Could you break that down a little bit for us, please?
Now your question is what? I'm not sure your question.
So, all right, I'm sorry. Amyloid. I was trying to understand what an amyloid deposition is. Those seem like
Okay.
pretty hard
Oh,
terms.
okay. Amyloid is a protein product that is not good anywhere. For example, it is found in the heart. Amyloidosis of the heart, it's found in the liver. Wherever it is, it doesn't belong. And so when it's found in the brain, it destroys, it is thought that it destroys the brain. When it's found in the heart, it destroys the muscle of the heart. So that wherever you have amyloid where it doesn't belong, it causes problems. Now, with Alzheimer's, one of the things that they found was that there was a lot of amyloid deposits in the brain. And so they
Okay.
linked Alzheimer's to amyloid deposition. And so
Got it.
medications that break down amyloid are thought to be helpful in treating Alzheimer's. But most of the medications that we have haven't been very effective against Alzheimer's. So the question is, which comes first, the apathy or the amyloid. Is the amyloid a consequence of apathy, or is the apathy a consequence of the amyloid? But the association of amyloid deposits is thought to be one of the manifestations of Alzheimer's. I don't know, is that clarifying or make it even more complicated?
No, that helped to clear it up for me. Thank you very much.
Buchanan?
Yeah, so I think my question might be answered by this first statement, apathy. I was wondering how the heck do they measure that apathy?
Just psychological tests. That's how you have to do psychological tests. They have all kinds of psychological tests that they use to evaluate apathy and other depression and other things. Yeah.
So how would even somebody even think that that would be related? That's really wild to me.
Well, it's some would argue that apathy is in many ways very similar to depression. Depression is you kind of have a lack of response to things that occur. Apathy is actually no response at all. You may say that depression is a subdued response, whereas apathy is no response at all. And so they can measure that by psychological tests that they do all the time. I just happened to work with a lot of psychologists, and they had all of these tests that demonstrate your psychological reaction to all kinds of events. And those people who don't respond at all, call apathetic. Those people have subdued responses. They can consider them as depressed.
It seems to me
Dr.
that there's some apathy and depression screening questions for wellness exams.
Any other comments or questions about this
I'm glad to
observation?
know that it's not the healthcare providers that are being apathetic.
Well,
And
there are
that,
many people that are apathetic there.
no, I'm talking about the healthcare
Providers
providers
as
and
well
their
as
treatment.
as
If
well
they're
as
apathetic, then that means their treatment is going to be inferior.
now who are you talking about? The
Healthcare
healthcare provider
provider,
or the patient?
healthcare provider.
Yeah. Well, I now, so I'm not understanding your question clearly. You're asking whether the health provider has apathy or the patient.
I was saying I'm glad to know that it is not the healthcare providers that are apathetic about this.
Oh, okay. All right. Yeah. No, it's the patients. We we're hopeful as you are that the healthcare professional is sympathetic and even empathetic. Right. Okay, let's go to the next one. This is something that we've talked about, have talked about recently, though, is that how important exercise is to arthritis. When you have pain, you kind of don't want to move your joint. But in reality, the best thing you can do is to move your joint. And so this article talks about the sooner you start exercising, the better it is for you, regardless of whether you have arthritis early or late. But the earlier you start the exercise, the better off you are. And there was a time when people thought if you had pain, you don't move it. Now we know better. We know that the cure for arthritis and the best way to get positive results with arthritis is to have early exercise. And for example, after you have a joint surgery, one of the first things they want to do is exercise. And then rehab is all about exercise. Exercise. Moving the body part is good for you rather than not moving it. That's true for almost many things. Keep moving. Stay alive. Keep moving. Any comments on this? Yes, Buchanan.
I had a little experience with this during COVID. They shut down all the swimming pools, so I started walking to get my exercise. 10,000 steps, and I was getting up to 6, 7, 8 miles a day in walking. But then I developed like some hip soreness, knee soreness on my right side. Okay, then the pools opened back up. Oh yeah, I was taking that meloxicam, and that helped right away. But I read about side effects of taking that medication. So when the pools opened back up, got back to swimming, and I had pain in my right shoulder, and I started taking the meloxicam again for my shoulder. But then after a while, I stopped taking it, and just that exercise of swimming on a regular basis, I don't have any shoulder pain at all now. And I think that this article talks about that. You get that joint in motion, and I don't know how it works, but I don't have any soreness or pain at all.
Yeah, it's almost miraculous. I had a lot of problems with knee, osteoarthritis in the knee, and I started exercising, and it went away also. And I tried to tell others about it, but they didn't seem to pay much attention to it. But your example proves the point. Yeah. Any other comments about exercise and arthritis? Since as you age, it's something that seems to, as you age, osteoarthritis becomes part and parcel of your aging for many people.
It's counterintuitive though. It hurts, so you don't want to move it, but actually moving it helps it.
So true. Betty?
Yes, I piggyback on what John is saying, because my husband has had 2 knee replacement surgeries, and so he feels like he can't move. He doesn't want to walk much. He doesn't want to do anything else. And I will throw in the fact that he's also lazy. So therefore, he went out and bought this new machine that moves. You plug it in and it moves. You just put your feet on it. And so that's what he's using now. And I get after him so much about wanting to move. He still doesn't want to get up and walk, but he did spend his money and buy this machine so his legs can move.
Any other comments? Yeah, Janice.
Yes, I agree with the article. I have too many friends my age and older, 70 plus, and it seems like it's the knee, the first thing to go. And I don't know what's going on. I took these herbs and that's going to take care of it. I put this salve on it and that's going to take care of it. And they'll do these things for a year or two. Eventually, yes, they have to have surgery, but it never occurs to them exercise. And the ones I'm talking about do not exercise. And I have a friend now who found a doctor who will give her a shot. And she's good with that. He said, I can come back in X number of months, but I'm sure eventually she'll have to have surgery. So I don't know if some people are just lazy or they're not thinking clearly to get that shot or to put a piece of salve or cream on it, they feel it's going to take care of the problem. But I think, and Dr. Callender, you preach this all the time, the older we get, the more we need to exercise.
Dr. Callender, just recently I heard from 2 doctors. They say if it hurts, don't move. Wait until it stops hurting. Now, is it just for certain areas of the body, or is that a general statement for your whole body?
Well, I think what we said, exercise, is a general statement that if it hurts, if you have pain in your joint, the best treatment for it is exercise. And I just don't agree with your doctors.
And what about the back area?
Oh, I don't know, but I was talking about the joint areas. Now the back,
Yeah.
that's different. The
All right.
back is different. I was talking about the knee joint, the elbow joint, shoulder joints, and those. Back is like another world there.
Thank you.
Yeah.
If it's your back, you can't move. If it's hurt.
Well, they have special back exercises.
Yeah.
So, it depends. That's why you have the physiatrists, because they can actually do those things that allow you to have good back exercise. They have back exercises that help with your back, and back treatments that help.
Yeah, I think being in your 70s and older is so special because it's that part of life where if you don't exercise at least some moderate exercise 3 to 4 times a week, if you don't do that, it's guaranteed that when you're past 70, that you'll go to bed hurting and wake up hurting. But I mean, that's not a given. That's not a given just because you're over 70. Because if you do that moderate exercise 3 to 4 times a week, you can avoid going to bed hurting and waking up hurting. You can be limber without those ongoing pains, which are just arthritis. And so what you're doing is you're putting off arthritis, and it's really worth it to get in that habit to that moderate exercise. Don't overdo it, because you overdo it. You walk that 5 miles a day because the pools are closed. That's a long way to walk. It's overdoing it. Yeah, but just a moderate exercise. We don't need to be Olympic athletes when we're over 70. We just need to do things. If that's, I hate that expression, all things in moderation, because that's saying a little bit of cocaine in moderation is okay. But that exercise in moderation, that'll keep the boogeyman away from people over 70.
And the
Mark,
good thing, you don't have to go outside to do it. You can exercise in your home, in your
that's
bed.
right.
Yeah.
Mark, you had a comment.
The strongest muscle is our willpower. And because that will take care of a lot of things. And willpower is connected to personal discipline. Where we lack, even for my generation, is just a personal discipline. So whether it's eating right, whether it's exercising, and it's a personal discipline to tell yourself what to do. Is what I teach my students is, not to go on feelings. I don't feel like it today. I don't want to do it today, but just to make yourself do the things you don't feel like doing is discipline. Jesus said it best. He said, if any man come after me, let him deny himself. The ability to deny yourself is a personal discipline that, if we can master that, or if we can get a handle on that, I should say, I can't say master, but if we can get a handle on disciplining ourselves, then the rest will come a little easier than not, is my opinion.
Well, one of the things I have to say, Dr. Perez maybe not be on the call anymore, but she has expressed that many of the things that this group talks about is something that needs to be shared with the rest of the community at large, because the comments that all of you have said today are the real truth. And how do we get this kind of truth to be accepted by the communities at large, so they don't suffer as much as Because one could argue that they're needlessly suffering. When in point of fact, the remedy is right into their hands. Let's
One last thing, our music industry has a lot to do with that. And the songs, I forgot what year it came out. It's your thing, do what you want to do what you feel like doing, be free. If it feels good, do it. All those songs, and they subliminally go into our psychic, and we actually believe it. I don't do anything unless I feel like doing it, which is so disciplined. And I'm sorry to say, I've even heard some of the medical field, if it's not feeling it, just relax and everything. But discipline means you're gonna have to do a lot of things, like Mark said, which is the gospel truth. You have to discipline. And I've heard my brother tell me that a lot of time, how to build discipline. And that's one of the key things about it, is having discipline, making yourself do things whether you feel like it or not, because it's good for you.
It's Your Think is a funk single released by the Isley Brothers in 1969.
before many of you were born. Huh? Okay.
And to that point, I know for a lot of the adolescents that I had the honor to take care of, and why this group and dissemination of this knowledge is so important, is because from their homes, the whole issue of discipline might not be there. There might not have been a model. I mean, we have families that have generations of significant dysfunction and what we call ACE, adverse childhood effects. It's generational. So it's important to say and for our young people to have models that push them in that direction. That we not all of our kids grow up in environments that have any discipline.
Well, our kids should, because we should give that to them.
I don't mean our individual children. I mean the children in our community.
Oh, I agree.
So I'm saying when we absorb the children of the community.
Yeah, I think I've noticed that, and that's frightening.
But okay, going back to discipline, we've come from, even slavery discipline was harsh. Black parents, because their parents were harsh, discipline with them, then they're going to be harsh with because that's just natural. But we got to get to that medium. And now we have a generation, well, if they feel like doing it, and even if they're younger, what you feel like, what you're comfortable, they may not making the right decision is according how they feel about it. So we got to get to that happy medium. And then we got the generation. I'm not going to be harsh like my parents. I'm not going to be discipline them like that. I'm going to give my children a choice. And a lot of times they're going to make the wrong choice. So we need that happy medium, because parents are revolting. Why this generation doesn't want to discipline them? Because they were disciplined too harsh. You even hear ministers talking about how their parents beat them with cords and everything, which was too harsh. So you're going to have that generation that's going to rebel because of the harshness of their, quote, discipline.
Who says it was too harsh?
There you go.
It was too harsh when the scripture says that, even when you have a child that's rebelling against because of discipline too harsh, when you're leaving scars that last our generation, that's too harsh. When a child doesn't even know why they're being disciplined, just because mama looked at them and not talking to them, even God told us why he was disciplining
But
us.
that's not proper discipline.
It's not
I'm
proper.
talking
And the
about
older generation did not do proper discipline. We seem to think,
I don't agree with you. Some
Oh,
did,
okay.
some didn't. I got disciplined, but I think it was appropriate
Thank you.
Yeah.
for not doing dishes.
for not doing what I was supposed to do. And that was appropriate.
I agree with the scars comment. If there's a physical scar and if there's an emotional scar that lasts much longer than what it should, then that's probably a little heavy-handed.
Well,
And
you know,
as we have talked about on this line, it's intent and communication. I was whipped, but there was no doubt in my mind that my parents loved me. There are kids that are quote unquote disciplined, and it's really the outrage of their parents, their anger. We've got to get to the point that what was the intent? The intent is to protect. We talked about how women love their sons and raise their daughters. You know, and a lot of that was because we knew that they were coming after Black men. And the intent was to protect them because they were being lynched. So the intent, the love, all of that has to be there. And I remember when I had to spank JC because he lied to me and he was little, and I gave him a spanking. I gave him a spanking because that had been what was modeled to me. Now he's 45 years old. I might have done that differently, but I didn't know better. But there wasn't a spanking. I don't know if they could accept the fact that I loved them at that time, but that was very, very important.
There needs to be a discipline in disciplining. As a parent, you know, I realize that, you know, it can't be just because I'm having a bad day. It can't because I'm mad at my spouse. You know, you know, and I can't just go ham, go crazy with my kid just because I found out something, you know, tragic. I have to be, you know, strategic and disciplined in how I'm disciplining versus just letting my emotions just kind of fly off the handle. There's a difference.
We got some
Yeah,
confusion going on here. Okay, punishment, we know what punishment is, but discipline can be a skill. That's a separate thing. So a gymnast develops a skill to do everything necessary to be a gymnast without anybody telling them that they have to. You know, discipline is learning the skill that you can do the things that you don't want to because you recognize that there's a greater good that you're pushing for. But you know that so that teaching discipline is not the same. You can punish somebody, you can give them that discipline all day long, and they never learn any discipline. They just learn how to avoid punishment.
Touche.
That's true, but I'm
okay. Have
thinking
we
about
exhausted discussion on that? Guess we go to the next one, which is treatment of baldness, which now we have 3 different drugs that are available for treating adults who are bald with alopecia areata. That's what alopecia areata is. And FDA now approved 3 drugs that are effective at, and they said about increasing here up to 80% of what it was before as a consequence of these medications. And these calpia medications have side effects like all medications do, but it is capable of restoring hair, and this is something that many bald men would wish they had. Any comments about this? This is it's amazing as we grow, we find treatments for almost everything.
Dr. Callender, is this treatment effective after the fact?
Well, most of these people that they say here had lost most of their hair, and at the end of the study, 80% of the hair had been restored. So it doesn't say that people who had no hair, but it talks about people who had 30% of the hair. So that's for this particular study.
Dr. Callender, is this, I've heard of it more in the Black race than in the white race. Is this just overall? Because I guess maybe I've seen it more in the Black race than in the white race.
It's ethnically, every ethnic group has it.
Oh, okay. How come we don't see, I don't know. My father had alopecia, and I know a couple of ladies that had alopecia, and well, maybe I haven't been around the other races just to recognize it as much.
Oh, I see a lot of it in all races.
Okay.
I'm talking about the males. I don't know about the women, because with the head, with the wigs, you never know what's going on with women. But with men, it's clear in all ethnic groups that I know of.
Once we were in a choir stand, and I asked John to count how many women actually had on wigs, and almost every single woman had a wig on except for one. So maybe it was just a style. I don't know.
It's certainly clear that for men we know, for women I have no idea.
But the style today seemingly is bald heads for men. So maybe they aren't going to be worried too much about this right now, as long as the style is.
Yeah, it's interesting how it has changed over time.
Yeah.
I've seen a lot of women bald head, and they're, and it's not always related to cancer or, the chemotherapy or whatever.
Yeah.
My hair is thinning so much, and they tell me it's because of my aging, that I've considered it.
Well, now you've got 3 new drugs for baldness. So. Food for thought.
I was talking to the point of just shaving it all off.
Oh, yeah.
Well, if it is thinning, if it is just thinning, like Dr. Perez said, do you think you could use that on the portions that's thinning? Or I mean,
well, that medication they're talking about is for people like that.
Okay.
Yeah. That's exactly who would profit from it.
Okay.
And you probably would need to have the referral to the dermatologist for that, which brings in an issue of equity and insurance coverage. And we could be here until this afternoon discussing that disparity.
So it's not something you can just buy. That's what you're saying.
Well, no, as she's saying, most people, you need to go to a dermatologist and get a referral.
Okay.
That's who would, that's the medium, that's how it occurs. You go to a dermatologist, they evaluate you, and then they get you treated, and then but there's a large number of dermatologists available. So, but you don't just go to the store and buy something for baldness.
Yeah,
You should go to a dermatologist and they would refer you. Okay. Go ahead, Darryl.
that's great news, because even though baldness may be a style, there's hardly anybody that wouldn't want the full head of hair they had when they were 20 years old. And minoxidil had some terrible side effects. So if some of these new drugs can be effective without side effects, that is wonderful. I could be 20 years old again.
No.
Yeah, I was never thrilled with my hair anyway, so I don't necessarily miss it.
And John Tatum had one of the best afros of all time.
Oh, really? Okay. Any of you who eat dark chocolates, they have noticed the cadmium and lead in some of the dark chocolates, and they did a 8-year study, and they did find lead and cadmium. They claim that the lead level and the cadmium levels were not particularly high, but they were there nonetheless. So it appears though that there aren't a whole lot of dire consequences, but the fact that you've got lead and cadmium in there is something. Lead is not good, except maybe for bullets, but lead is not good in the body. So those of you who love dark chocolate, be so advised.
Dr. Callender, I don't eat that much dark chocolate, but what I was thinking about was like, when you make cakes and the cocoa powder, that you use to make maybe chocolate icing. I mean, never even thought about that when I saw the article and it mentioned cocoa products. And I'm thinking about the cocoa powder that we use to make icing on our cakes.
Well, I think this is specifically talking about dark chocolate. Remember, the other chocolate is already processed, and so it wouldn't be the same.
Oh, I see. Okay.
Dark chocolate is probably the more natural of the chocolates, and the chocolate, the regular chocolate we have is already processed, and a lot of the stuff is taken out of it.
Oh, I see. Okay. Thank you.
So this is specifically for dark chocolate.
Dr. Callender, didn't we have an article that told us that dark chocolate was better for us than milk
Yes.
chocolate?
Yes.
Why
Yes.
was it better for us?
Because it wasn't processed as processed as the other chocolate is. That was why. And it has more antioxidants and flavonoids than the regular chocolate.
So it's better for us, but we shouldn't eat it because it's got metal in it.
No, all I'm saying is that it has been shown to have cadmium and lead. Now these are contaminants, and they say that it's not going to harm you, but that's what they say today. I don't know what they'll say tomorrow.
And the wording is so tricky. The title says some dark chocolates contain heavy metals. Should you be concerned? I like how they put a question mark on there. No, it's not giving us anything outrightly definitive.
Right, they are not saying, they're just saying that it is present in dark chocolate. And they haven't not said that it's going to hurt you, but they're saying that you are going to, that you will find some small amount of cadmium and lead. And so, and as we know, lead is not good in the body at all. So, but they aren't saying that it's dangerous. They're saying that it is present. They're saying, for example, that it's negligible. That's what the conclusion is. Yeah, but that's negligible today. Now, tomorrow, I don't know what we'll say.
So dark chocolates in moderation, but not cocaine. Okay.
Yeah. And this article goes on to say that it may not pose a health risk. As I was saying, time will tell over time. what they're saying today may not be what they say tomorrow. So be advised that there is a concern. Let's go to the next one. I think we go to 10:30. This is an article that says that high systolic blood pressure is linked to females having migraine. This is one of the first times I read an article that correlates the lower aspect of your blood pressure to migraine. Of course, any of you have migraine on this call? Migraine is a headache that doesn't go away with aspirin. I mean, that's the way of putting it. And it's one of the worst headaches you can have. And they're saying that this is more common when you have a high. In the blood pressure, the top part is the systolic, the bottom part is the diastolic. And a diastolic pressure greater than 80 is high. And if it's over 80, then they're saying that it is related to be associated with migraine. But since nobody on this call has it, I guess you don't worry too much about it. And this is probably the last article, but this points out that after heart disease, after first-time hospital, that many anxieties and depressions and people have mental health issues because they finally find out they're vulnerable, they have heart disease, and sometimes they get suicidal and depressed, all of that. And, they're saying that we should, as physicians, we should ensure that our heart disease patients get mental health evaluations so that they don't have severe anxiety, depression, and suicidal ideations. This is something that we, as physicians, we really never thought much about before, but it's something that we now recognize is more important. I think there was an article that came up last week, the week before, that said there were 10 million calls to the suicide number in the 2 years it has existed, which is amazing. That we have so much mental illness that we have not really addressed. And that's an area of concern that we've talked about a lot, but we haven't really addressed to the extent to which we should. Go ahead.
Unfortunately, I had to intersect with the hotline number for a physician that was in crisis. And I was surprisingly impressed with the quality of my interaction with it's not 1-800, it's another number, but with that service. And it was at a point where I couldn't get a hold of another psychiatrist, and I had to use it for immediate intervention in another city. I was out, in the DMV, And this young lady was in Atlanta. But I was really, really impressed with the service. So
That's good to hear.
yeah, putting it out there.
Yeah, I'm happy to hear that because one of the things in medical school, the medical students aren't adequately prepared for dealing with suicide. So the suicide hotline number, and also to recognize that you can't tell somebody who's suicidal to just go somewhere. You've got to actually intervene with them, as you did, and that's important to understand. That you have to either go with them to the emergency room, or you got to go with them to the hotline so that they can get help now. Not promissory notes, but help now. Any other concerns or thoughts as we close? Thank you for
Dr. Callender,
yes.
I put a message in the chat for everyone to take a look at before you sign off.
Congratulations, John and Carol, for 54 years.
Congratulations.
54
Can we
years.
get the applause, please?
When is the date?